Hi, Mr. Green. Welcome to your meeting today. This meeting is just so we can uh, look at your results of all the exercises and other testing that we've done so that we can help you get on a healthier path. Looking at your family history, I noticed that you have a family history of heart problems and diabetes, uh, and you also smoke 2 packs of cigarettes a day. Now we can address the family history of heart problems and diabetes with exercise, and I'm going to set you up with a dietitian also to help with those 2 risk factors. Now, smoking, if you would like to talk about smoking cessation programs whenever you're ready, uh, I can help you find something to assist you in stopping when you're ready to make that decision. I also see that you do not participate in regular physical activity, and it's my goal that you will, after our meetings and working together, will learn to enjoy physical activity again, and this will help all of the risk factors that we're fixing to talk about, and it'll make you have a healthier, happier life. Um, First, let's go over your lab results of the blood tests. Your total cholesterol was 170. That's a good spot, and we just want to make sure we keep it under 200, so we're right on track there. Doing a very good job with our cholesterol, which means you're not doing a terrible job picking what you eat. Uh, your LDLs, which is the bad cholesterol, um, is at 100. Now, we do want to lower this just a little bit. It's right above the optimal level, and we might as well be optimal. So I'll set you up with a dietitian and we can talk about ways to lower that just a little bit. Your HDL level is at 50, and that is great. It's exactly where we want you, so we're good with that. Also, your triglycerides were right in the range where we wanted them. The glucose, however, your blood sugar, was just a little elevated, and that's just an indicator for a precursor for diabetes, and given your family history, we need to pay attention to that and do things to help lower that so that we can avoid diabetes if we can. Now for the exercise part of it, to get away from your blood for a little bit, your resting heart rate was 80 beats per minute. Now, that's still within the normal range. However, we do want to bring it down as close to 60 as we can get it. But at 80, it's not really something that we're going to lose a lot of sleep over. Your resting blood pressure. Now, this is where we start running into problems, okay? Your systolic blood pressure, which all that is how much pressure is in your arteries while the heart is actually working, puts you into the hypertension stage 1 classification. And the diastolic is also just a little high, and all the diastolic is how much pressure is in the arteries, while the heart is relaxed. The reason we don't want this to stay high is because you can get hardening of the arteries, which causes just a lot of problems. Next, the push-up test. You got 11, which puts you in the middle of the good range, which isn't surprising given your profession as a farmer. I'm sure you have lots of hard work on a daily basis to keep you nice and strong. However, your core strength is not where we need it to be. Given the curl-up test, you got 6. It really needs improvement. And what this will do, this will help us. It'll help you feel better. It'll prevent injuries. It'll make your job a lot easier, and life in general just feel a lot better. and it'll keep you healthier. So we'll put a lot of core strengthening stuff in your exercise program that we're fixing to start. Your sit and reach test puts you in the fair category with a 19. One thing we can do to get you into the good category instead of just the fair is add flexibility just after you get off of the tractor, or get done doing anything in the field. I know your sons do a lot of the heavy lifting now, but anytime after you do an activity, we can teach you some stretches, and just do those throughout the day, and it'll really, really help. And that'll help your lower back pain. That'll help your just your flexibility in general, and make you feel a lot better, and also prevent lower back injuries. Now, moving on to your body comp, you're at 31% body fat. That puts you in the high category, and we need to add. So, of course, we need to add exercise. And like I said earlier, we're going to set up a meeting with a dietitian if you would like. And this will also help us give you some strategies to help correct this. Your waist circumference was 110 centimeters, which puts you again in the high category, which is a risk factor for diabetes. And given your family history, we want to eliminate all of the risk factors that we can. That everything we can control, we need to try to control it a little bit. So starting the exercise program, and again meeting with the dietitian and getting some strategies to start lowering the body fat percentage. It's going to help us control the waist circumference and reduce that risk for our diabetes. Do you have any questions? Thank you.